Let's learn about infection control details of environmental surveillance, which is needs to be done whenever an outbreak is suspected. Water analysis needs to be done once a month, and screening food handlers for carriers of enteric pathogens biannually. All dietary staff will be given the following vaccinations such as typhoid vaccine and hepatitis A vaccine. Engineering controls to prevent include maintenance of the HVAC system, that is heating, ventilation, and air conditioning, then water supply, building, and the supply lines. Engineering controls are important for preventing infection in hospitals, and they have made the basic requirements for environmental controls includes water management, heater management, and protective environmental rooms and facility management. General requirements for pipelines are proper color coding of different pipelines like drinking water, RO lines, fire pipelines, and sewage water lines. Up-to-date drawing of the pipelines. The general requirements for the water tanks are cleaning schedules will be in place, records of the date of cleaning, the disinfectant used, name of the person who cleaned the tank, then tanks should be kept closed, should be marked with details regarding the type of water, tank's capacity, last cleaning date and due date. They should have a water level indicator and should have safe access with a ladder. Testing drinking water involves testing for the physical characteristics such as color, odor, taste on a daily basis. And chemically once in 6 months by accredited facility like enable accredited labs. Then biologically it includes every month by microbiology department in-house or outsourced and added to the sources before like borewell and tanker well and once in 6 months. Then testing sewage treatment. This involves physical checking for the physical quality daily, the chemical quality once in 6 months, and biological quality monthly. The sewage treatment guidelines should be followed as per the Pollution Control Board. Water analysis should be done once in a month. RO water should be checked weekly by residual chlorine check at terminal ends before connecting to machine. Introduction levels should be checked once in a month. Scrub water should be checked once in a week. Theater environment should have the zoning done appropriately. Entry should be restricted in the OTs, so patients should not be brought beyond the red line in theaters, and transfer toilets should be used. Theater staff should wear proper attire. Operation theater walls and floors should be free of crevices. Floors should be seamless. This will prevent accumulation of dirt. Cleaning records should be maintained. It is mandatory for full NABH accreditation to have facilities such as individual air handling unit for each theater, laminar flow and HEPA filters in case of ultra clean theaters, air changes, positive pressure, relative humidity and temperature should be monitored and documented daily. The air conditioning system should not be switched off and should be maintained with a VFD and a blower to prevent spore formulation in the ducts. The integrator of the filters and the system should be checked every 6 months. HEPA should be changed if the particle count is high. The pre-filters of the AHU should be washed every week and maintained appropriately. Records of checking should be maintained. For entry-level certification of the healthcare hospital, split AC system and window AC are permitted in theaters. The filters of the window AC should be cleaned weekly and units should be maintained weekly. And the process should be documented. Protecting environmental rooms like burn units, transplant units, and isolation units should be planned and constructed as per the norms. Air conditioning requirements like positive pressure in case of transplant or burn units and negative pressure in case of isolation units should be provided. If isolation units are not available in hospital and patient with airborne infections are admitted, then to prevent the spread of airborne infection, each patient should be placed in single or private rooms with closed doors. Patients with same lines can be placed in the same room. There should be no central AC supply in any rooms. Each room should have separate AC units. Doors should be kept shut in an isolation rooms. Windows should be open. Inlet and outlet AC ducts should be blocked. Powerful exhaust should be in place. Let's see the infection control guidelines for the separate areas should be designated as a mortuary and should be under lock and key with strict access control. The facility should be clean. It should have a cool storage with temperature monitoring and power backup. The staff should perform hand hygiene and wear a proper adequate PPE. The biomedical waste should be safely segregated and disposed. The mortuary should be free of pests and rodents. The entire process should be documented. By HSC4 guidelines of NABH, the organization should implement the IPC program support service. This includes the organization should have appropriate engineering controls to prevent infection. The organization designs and implements a plan to reduce the risk of infection during construction and renovation. The organization adheres to housekeeping procedures. Biomedical waste is handled appropriately and safely. The organization adheres to laundry and linen management processes, and it adheres to kitchen sanitation and food handling. The risk assessment required with respect to areas surrounding the constructions needs to be addressed. There should be a multidisciplinary team to deal with the infection control issues in of constructions. They should have a document which lay out the risks and mitigation of the same, and process to monitor and audit. An infection control risk assessment form should be in place to monitor the constructions infection control program. This is the slide which shows about the ICRA form, that is the infection risk assessment form, wherein the type of activities are categorized as type A, B, C, D, and according to type patient risk groups are categorized as low, medium, high, and highest risk group. And accordingly, the areas are categorized as low, medium risk, high risk, and highest risk. And description of the required infection control precautions by these classes are mentioned in the infection control program for construction activities. So that needs to be added. Then coming to infection, environmental cleaning and disinfection. Environmental daily and terminal cleaning protocols should be in place. Frequently touched surface areas should be cleaned and disinfected. There should be a checklist to ensure protocol is followed. Use of dedicated cleaning materials who are isolated needs to be in place. The role of fogging is important. For fogging should be done with a disinfectant high to medium level disinfectant as per the areas. A cleaning checklist will be in place to monitor over the cleaning of the various high touch surfaces and other surfaces of the patient clinic. This is a visitor policy which includes time restrictions, number of restrictions, use of PPE, and education information to visitors regarding hand hygiene, cough etiquettes, and others. Thank you.